as it hot for health matter. This health talk show will educate you on all you need to know about health and its related issues. I am your host, Honorable Confidence, and here with me are
Kamna Vivian Chinasi, Paul Gift Mesoma,
Okay, Naya Princess.
Even blessing Mary Penny.
Mama Mr. Martinez.
Thank you, everyone. So, we bring to you an interesting health topic that has been disturbing a lot of people today, especially female. So, the topic is vesicovaginal fistula, also known as vvf. So, we are going to talk about the definition, causes, signs and symptoms, the types, pathophysiology, prevention, as well as the... So, Nurse Gift is going to handle the definition as well as the causes. Do well to listen to her. Nurse Gift, please.
Thank you. So today we're going to talk about vesicovaginal fistula and rectovaginal fistula. This is an abnormal connection between the surrounding organs. Vesicovaginal fistula is an abnormal connection between the bladder and the vagina, whereby it causes a continuous and involuntary passage of urine through the vagina. Why rectovaginal fistula? This is an abnormal connection between the rectum and the vagina, whereby gases, feces can pass through the vagina. That's that for the definition. Thank you.
Okay, thank you so much. Thank you for that nice part on the definition. You also take us again on the causes of the vesicovaginal fistula.
Thank you. Okay, this can be caused as a result of surgical complications like gynecological or colorectal surgeries such as hysterectomy. It can also be caused as a result of obstetric trauma like prolonged or obstructed labor, like uterine ruptures and instrumental delivery. This can also be caused as a result of some trauma like sexual violence, accidents. It can also be caused as a result of cancer when some people have cancer of the urethra, cancer of the bladder, cancer of the vagina, and it can also be caused as a result of some birth anomalies, like when a child is born with some defects in them, which can result to this. Thank you.
Thank you so much. That was a lovely part on your side.
Thank you.
Thank you. Now we are going to take the signs and symptoms. Let's know how we can know that this is really vesicovaginal fistula. Nurse Lillian, please, you help us on that.
Thank you. Note that the symptoms of this vesicovaginal fistula depends on the size and location of this fistula. If present for a long time, there is a risk of developing an infection, and it is important for you to contact your healthcare provider if any of these symptoms occurs. Number one, there will be gas release from the vagina. There will also be urine inconsistency. There will be pus in the genitalia area. There will be soreness. There will be foul smell vaginal discharge. There will be also pain during intercourse, that's pain during sexual intercourse, and irritation and discomfort around the area. Thank you.
Thank you so much. That was a lovely part. So much appreciate. So thank you everyone for listening to Nurse Lillian on the signs and symptoms. And I know you grasped a lot from there. Now we are going to go to the types and as well as the pathophysiology. We have our lovely one, Nurse Merit. Please take us on that.
Thank you so much. Speaking of the pathophysiology of fistula, I will start by defining anal fistula. What is anal fistula? Anal fistula occurs when there is a tunnel between the rectum is the passage that leads to the anus, between this rectum to the skin close to the anus. This occurs due to the abscess. When an abscess refuses to heal properly, when the pus have been drained out, leaving a hole between the rectum and the skin close to the anus. Then we have again the vesicovaginal fistula. We have different types of vaginal fistula, but I'll be speaking specifically on two types of vaginal fistula. That's vesicovaginal fistula and rectovaginal fistula. What is this vesicovaginal fistula? This is a hole that occurs between the vagina and the bladder, leading to the seepage of urine from the bladder into the vagina. Then rectovaginal fistula is a hole between the vagina and the rectum, which lead to the seepage of fecal matter, that's feces, into the vagina of a woman. And what does this situation lead to? It leads to foul vaginal discharge. Vaginal discharge that comes with foul smell. Then it can also lead to seepage of urine to the vagina, which can lead to infection. Seepage of fecal matter to the vagina, which can also lead to infection if proper care is not taken. And note that anal fistula occur mostly in men, while vaginal fistula occur in women. Thank you so much.
Thank you so much. That was a huge part. So we are going to the prevention. You know, when you talk about these health issues, we also talk about how you can prevent it as a person. So, Nurse Princess, please, can you tell us how we can prevent it?
Thank you. As we all know, the major treatment to VVF is surgery. But as we say, prevention is better than cure. So I'm going to be outlining some facts that will help you to prevent this VVF. I'll start by saying eat well. When I mean eat well, I mean eat healthy. When you eat healthy and eat well, it's going to help you build your immune system to fight against some diseases like cancer. And when you're eating, you're going to include zinc, food that contains zinc in your meal, because it helps you prevent this VVF. Secondly, I will say treat urinary infections and pelvic infections early enough. And also adhere to the prescription made by your doctors. The next one is proper checkup of a woman after delivery for early dictation in case of someone who has this VVF. Avoid prolonged labor. When I say avoid prolonged labor, I'm talking to the midwives and the doctors, the personnel in charge. You need to monitor this woman who is in labor to know when to refer or when things are getting wrong, because this prolonged labor leads to trauma to the pelvic areas, and which can cause this VVF. Another thing is teenage pregnancy. As a child who got pregnant, who is yet to mature or who hasn't reached adult stage, that pregnancy can also lead to this VVF. I will also tell you to avoid harmful traditional practices. We all know them. So instead of going to the hospital to take care of themselves and give birth, they go to the shrine and other things are conducted to the body. But when you do this properly, by avoiding these harmful traditional practices, you can also be helping yourself to avoid.
Thank you so much, Nurse Princess, for that detailed explanation. That was really nice. Now, fans, we are going to talk about the treatment and management. Very important. Let's listen to Nurse Blessing for that.
Thank you very much. I'll be talking about treatment and management of VVF. These are some things you need to know about the treatment and management of VVF. Number one is surgery. VVF usually requires surgical procedure, and the surgery is usually an outpatient procedure, but one might need to stay in the hospital overnight if the abdomen is cut off, depending on how the doctor did the surgery, because at times it may require stitches or using tissue to repair the opening. Then another one is timing. The timing of the surgery helps in the recovery of the patient as well as the overall health status of the patient. Another one is catheter. Usually this patient requires catheter in vesico-vaginal fistula, because in vesico-vaginal fistula is where you have urine incontinence. So most time the patient requires catheter to stay in situ for some weeks during the surgical repair of this fistula. Then lastly, in the management of this fistula is the use of an antibiotics. Because one of my colleagues mentioned that infection is one of the things that causes this fistula. So in such case, you need antibiotics for the management and treatment of this fistula. Thank you very much.
Oh, thank you so much, Rosemary Bain. That was a lovely explanation. Now, guys, I know that you people have learned a lot on this topic. Thank you so much for listening. There are a lot of things you need to know about this, and I know you've heard them all. Firstly, that this vesicovaginal fistula, that it is an opening that develops between the walls of the bladder and that of the vagina. When this illness happens, we know that it is a serious one, and it's something that you cannot joke with. So when you discover this kind of thing, just like the signs and symptoms that my colleague made mention of, urinary incontinence and every other thing that she mentioned, you know that you need to reach out to your healthcare provider. And again, I know that this disease can make you feel so uncomfortable. Yeah. Sometimes most of the complications are painful coitus. You are unable to have sexual relationship with your partner because of the pains. Unable for you to clean that area because of the pain. Sometimes you have this foul smell. Do not feel shy. All you need to do is to meet your healthcare provider, and it will be treated. Just as she made mention of the treatments, you can use medication, you can use surgical intervention. All those things can help you. Do not panic. Please, we have come to the end of this Optimal Healthcare show for today. But stay tuned because we still have more coming. This December, we have another interesting topic that you will not want to miss, which is December and health. It's very interesting. Stay tuned.
Please follow us on our social media platforms, Optimal Healthcare, aka Aside Hot for Health Matter. Like, comment, subscribe, and share. Bye for now.
Bye.
Bye.